And this is what I love in Straumann, all the time checking, and more checking.
I perceive you as a very passionate person.
Yes.
I think you really burn for the things.
Where is the inspiration coming from when you have an idea for a new product?
First, it's come from the clinic. I'm placing 3,000 implants a year. The necessity is very important, exactly, to help people, the necessity. And then, because really, I tell you, my mind is, I have a lot of ideas, I don't do all of them.
Welcome to Straumann ProTalk. Welcome to the Pulse of Dentistry. My name is George Reber, and together with my co-host Andreas Utz, we are really pleased and also honored to welcome Dr. Ophir Fromovich. Ophir, welcome to Basel.
Thank you very much. Yeah, it's a very big honor for me to be with both of you, the leading of Straumann.
It's great to have you. So, today you will have the unique chance to actually step into the mind of one of the most creative innovators that dental implantology has to offer. We will start with looking into Ophir's journey and then, of course, deep dive on some of the breakthrough innovations that actually changed how we do implantology today. Ophir, for those who don't know you, who is Ophir Fromovich in just 1 minute?
I think Ophir Fromovich is a very simple person that get a bless from God to have innovative a little bit and to have some idea. He's not afraid to try and to do. And he feels that they have a mission. So I work as a mission, okay? For me, it's important to help society, to help people worldwide. When I go to course, I say to the people, you want to succeed in your journey? One advice. Any patient that you see that is your father, mother, and sister, and it's what you need. Mm-hmm. So for me, it's a mission to teach those people how to treat father, mother, and sister, and for a better society. So I work on a mission.
Mm. So you're a person with the mission, and we could feel this. We will come to that. So you're a very driven person.
Yes.
Maybe let's go back a little bit to the early days. In one of the interviews, you mentioned that as a child, you have been very fascinated by Leonardo da Vinci. And he is a genius combining science and art. Now, how has it been for you? When did you actually uncover that you had a mind of innovator? Was it at early childhood or just later in life?
No, very early childhood. I was feeling, as I told you, that I have some bless. And this, of course, attracted me to Leonardo da Vinci because I make painting, I make sculpture, I play guitar, and I have idea. And this was, attracted me. I like Leonardo da Vinci so much. And when I was kids, I was playing, I was buying, I was repairing motorcycle, I was building boat, I'm making electric motor. And all the time I try, I was working with my hand and do a lot of stuff. So for example, if you was coming to my room when I was kids, so when you stay on the door, I push a button and you get, water, that you don't know where the water coming because I took this from a car, the pump from the car and this. Or sometimes you get electric from this one because I was playing, I building motor and things like this. So from really childhood, people say, you have golden hand. I don't have a golden hand. I have normal hand. I just try. And one time my mother have a clock watch, the
pendulum.
Yeah. And it was broken and I decided to repair it. But I opened it and all the spring was jumping out and I was lost. So I don't know what to do. So I buy an electric movement. I put it there and I correct. I said, mother, look, now it's perfect. But she said, it's not move. I say, yeah, I cancel the movement. It's too much noise. So really, I was really all the time very curious. My mother say, you ask too many questions. And my father, why? Until today I ask why. Mm-hmm. So yes, I think it's a blessing. You get it. If you're an artist, you get it. Mm-hmm. You cannot be proud that you're an artist. You get it. If you're beautiful, you cannot be proud that you're beautiful. You get it. It's a gen. So the only thing that maybe you can proud is the power that you want to do something or to influence This maybe you can proud, but not all the time, because sometimes you have gen that give you more motivation. So you cannot be proud. We are nothing.
You spoke about your mother.
Yes.
And I think there is something else that she was very important for you to actually convince you to, not be afraid to try, right?
Yeah, I tell you, this is very important now to all the mother and the father. Really, I think it's very important. When you have a kids, you have to make him the king. You can do everything. You are the number one. My mother all the time say, you are number one. You can do everything. God bless you. If you have problem, talk to God, not to people, and do it. You can do. This is very important. When you have a kids and you say to the kid, you are bad, nothing will come out of you. And this influence the kids, and the kids will not be good. But if you encourage your kids like you're the best one, you're the beautiful one, wow, you can do, fight, the kids will come like this. You have power.
Ophir, so obviously your mother influenced you a lot, and you're a very curious person. And listening to your broad interests that you had as a kid, it was actually not clear from the beginning that you became a dentist, right?
Yeah.
So
I want to be an architect.
You wanted to be an architect.
And an engineer, electric engineer.
But still, after your military service, I remember you decided to become a dentist, and you went to Bucharest in Romania to get your dental training, and you went back, I remember, to Israel to do your first course in implantology. What drew your attention to dentistry in general and to implant dentistry in specific?
It's very simple, because I have so much problem in my mouth. And when I was, I need to treat myself. So after the service, I need to treat myself. And then I say what I want, electronic. I try to be architect, because I draw, but it didn't get me. So I didn't have the chance to go there. And then I like dentistry, but it was very difficult to go to dentistry. You need to be very upgrade. I'm dyslexic a little bit. So for me, my mark will not be the best, especially if it's a mathematics or physics. I was very good. Mathematics, no. English, until now I speak with a lot of mistake. But if I see picture, or if I see you in 5 years, you change your glass, I remember. Or if I need to see 3D, something 3D, I see it easy. Or if I do operation to a person and I want to change his face, I can see it. It's easy. So I have this helped me, I think, a lot.
Yeah, that's a super important skill for dentists, because it's all about visualization.
And then dental is together. Dental will give you, will give you medicine and give you smile and give you function to it. So it's medicine with some artist working, and this was attracting me.
So still, dental is a big field. How come you moved into implant dentistry? Where is your passion coming from?
So first of all, after I finished my graduation, I make orthodontics. I'm a specialist in orthodontic from Romania. Because I saw orthodontic is nice, is smooth, in those times it was not this technology, but I like it. My professor in Romania was doing obergazer operation or orthodontic operation.
Yep.
So I was a good student. I was like his first arm. So we was going together in the night. It was Romania. In Romania, it was communist time. So we go to the military hospital that was closed in 8, 9 o'clock in the night, me and my professor, with a lamping gear, with a motor of technician, and we're doing obergazer and all private operation that the professor was doing, and I was his assistant. And the professor was doing implant for his living, like Tremonte implant, like blade implant. So I was with him, and I learned it. And then I saw orthodontic, but my professor doing implant, and implant was just, 87, 86. It
just
was
in the beginning.
Just the beginning. And I was looking at this and I say, too simple screw. Too simple. How it's possible that, I'm a carpenter. I make carpenter, I make furniture, I build house, I'm working. I work with screw. And I say, okay, if this is a metal screw, the Brenner mark, external X, how possible a metal screw go to the bone? And I was already doing some extraction in the faculty and getting some bone and cadaver, and then I see, and I say, how it's possible that you have cortical and sponges, and you put a metal screw. And not only this, you do countersink. I said, this is crazy. And I talk to people and say, you are crazy. This is holy thread. And this is only countersink. How you dare? And I said, no. You know, it's the story of the king, the naked king. You remember, yeah? The naked king, everybody said, and the kids said, well, but you're naked. My king, you're naked. And for me, it was the same. So when I talk to people, people say that you are crazy. They was laughing at me, you know? When I come with the first implant that was not like the other, people were sitting that I don't know, maybe under drug, that I was invented this one. It's not possible.
So, I mean, this was really at the early stage of implantology, but still there were some established companies that actually offered those dental implants. So obviously you're really dissatisfied with what they offered to you. And did that actually then drive your decision to found your own company and actually, improve things as you have seen it?
When I was in the last year of dentistry, when I was a student, I make the first prototype. I go to somebody that was machine shop, and I bought some implant. I was not so rich, but I bought one Brennemark, one Zimmer, I bought. And I know how to make, because I know how to make drawing and sketch, because I have a background of the high school. It's a little bit technical, technical high school. It's theoretical and technical high school. And this high school is not like engineer, but it's sub-engineer, like technician or something. So I learn automation, I learn machinery, I learn drawing, and so...
In high school already?
In high school, yes. This is special high school. We have different high school, theoretical and theoretical with this one that are more difficult because you have to do two subjects. So I was in this one. So it's given me a lot. I know how to draw, I know this, and... So I was taking it, and, comparator is a machine that, that you put, and I check the measurement, and I make end drawing. Then I go to one, and I said, do me a prototype. It was disaster, but they do, because they're doing endly, so everybody was different, like a model. Every implant was different from the other. I never used them, but it was the first try. And then I decided, I say, this what they have, this what they have. I look at the history of implantology. I was going to America to meet Linkov and all the other group with subperiosteal implant. I was doing subperiosteal implant in the beginning for dog. Mm-hmm. Yeah, I don't do it for men, and blade implant I do, and needle implant. So I was going around and see the history, understand that the history have some very logic, but they don't have biological understanding and metallurgical understanding. So I'm like a small engineer, and I like engineering. So I read a lot about. I was sitting in the University of Metal University hours in the bibliothèque and learn ASTM, this, metallurgy.
The standards and then how to do the surface.
Everything, yeah, because then it was GLP. It was not ISO and C, and I do all the ISO and C I do myself. So I really was going to everything, and I have some, metallurgic engineer, because I do reverse engineering for all the surface. So machine surface, how to clean it, this one. Then SLA, how to do. Then plasma spray. I was building a gun to do plasma spray and to do hydroxyapatite and to sintering hydroxyapatite. So I was doing reverse engineering of all surface, all metal. I check it, final element, photoelastic. I check it, what I do in myself to feel it. And then I said, no. It's not possible. It's not good. And then immediate loading was nobody talk about immediate loading. And IP Brennemark was say, okay, you wait 3 months, 6 months up, 3 months down. And I, all the time, I say, why?
Why? Why to wait?
Why? And then I was building my theory. I say, okay, if the bone, you have cortical and have sponges, and you drill big drill, because you drill 3-1 and you put implant, you drill 3-2 and you put 375 implant, and the thread is 0.3 lengths, and some trabecular are bigger than the thread. So what is the logic to put it there? And why you do countersink? You destroy the bone. And then when people say that you lose 1 millimeter or 2 millimeter is normal, I say, no, it's not normal. You cause it. I remember one time I was in Astra, lecture. I was flying to Holland. I don't want to say the name of the professor. It's not nice. But I was sitting first line and come to learn and to see research about dog and this. And the professor from Astra say, look, I want to show you study between Astra and Brannemark, the external legs. And then he showed that he take Beagle dog and he drill to the Beagle dog and he do countersink and place this one, and he do Astra because Astra have narrow neck. You don't need countersink. And he do histologic and show that Nobel have big resorption. And then I say, can I ask a question? And he all the time say to ask me question. Everything is evidence-based. Ask me question to the audience. And I was doing like this. And he say, yes, please. And I say, don't you think that you kill all those animals for nothing? Because if you make only drill protocol for this dog, you will get the same result without placing the implant. One implant you do countersink, you destroy the bone, so you initiate resorption. The other one you don't. What do you expect? And then he say, no, he get a little. Then I say, I have another question. Did you take in a measurement of how is buccal lingual and mesiodistal when you drill, because you make a damage in the bone? How much bone you left, because it's critical size of bone. Did you take this in consideration? No, we don't take it in consideration. I said, so why? He said, no, because external legs have a lot of data. I say, yes, but nobody have stereos. It's very similar. It's straight on. Why you don't use stereos to compare to this one? And then I raise the hand and they say, no more question, out.
So very, very fearless question as we know you.
You have to be honest. Yeah. We taking care of human being. We have responsibility. We cannot. You know how many articles I can cut them with the way I even just see how the routine? Why? We have to be honest. We treat one each other.
How were your ideas then initially perceived by, let's say, the established companies or also thought leaders?
People don't want to touch it. When I come with the first SPI implant that was more active and have this one, in Israel, people don't want to take it. I was going to hospital to friends that was oral surgeon, because oral surgeon was doing the most. And I convinced them. I said, look at my X-ray. Look, I have 1 year. Look, immediate loading, immediate. No waiting, nothing. Look, immediate loading. I do everything. Try it. No, it's aggressive. I say, it's not aggressive. It's very gentle. It look aggressive for you because you don't understand the mechanism. But if you understand what is the drill protocol, you see that it's less traumatic. And I was giving like 100 implant free, 100 implant free, try it. And then suddenly in 4 or 5 months, I start to get so many requests. Mm-hmm. And I was teaching all the time, going around teaching, live demonstration. My clinic is open, my clinic is open. Because, when you swear about Hippocrates swear, what you swear? God, don't let me look at poor people or rich people and let me do my job, yeah? But in my swear is another one. Is a rabbi that called Rambam, and he put exactly very similar, but he put, give people that know better than me to teach me. So it means when I pray, not to do this, and to be honest and to be this, I pray that if some doctor know better than me, please tell them to help me. Don't keep it secret, because many doctors, like, they're holy. They're keeping secret. They don't tell the small stuff. And this is not correct. This is not honest.
It doesn't help to advance the field.
No, it's not honest. It's selfish. It's too proud. Yeah. You have to give. So my clinic, from all those 30 years that I work, is open for everybody that want to come to stay to ask questions and to listen. It don't pay nothing. Everybody know it. They come to my clinic, they're sitting all the time that I work. I have 3, 4, 5 people around me I teach. If I do course, then they pay because I don't work 2, 3 days and I'm for them. But I think every doctor have to open his clinic and to make a collaboration with everybody, because we treat our society.
Ophir, I'd like to understand better, your inventor mind, and maybe you can help me understand, where is the inspiration coming from when you have an idea for a new product? Like, You had it for the SPI, you had it for the BLX, and some others that you did before.
First, it comes from the clinic. I'm placing 3,000 implants a year. I have a lot of referral. I have a lot of complication to solve, a lot in my clinic. So I have big clinic. I have 15 doctor. Is 700 square meter, and we do a lot of implant. And I say, when my wife asks me why you go, I say I go to save people. I come in the evening, I say I save this lady. She have a beautiful smile. Or I save this old guy because he cannot eat. And this is what I feel. Okay, I save him. Because if I stay home, I can make more money by investment or doing something. When I go to clinic, I make less, but I'm more happy. Because, if you get money, okay. But if you do something for somebody...
There's a purpose, huh? Yeah.
So I said to myself, I'm selfish because I'm going to collect...
the good vibes.
Yeah, the good vibes for myself. I'm selfish.
Okay, clinics is number one.
So clinic is number one. Because you say what is missing. Because, for me, when I have now a course, I say to the people, you lose one teeth, okay? You like to do extraction, wait 2 months, bone augmentation, wait 2 months, put the implant, wait 4 months. So the patient will be 1 year with a prosthesis. You kill him. If what's yourself, I do it in 1 hour. I place the implant, I pay the bone augmentation, I put the gingiva graft if I want, it can go with the clown. So the necessity is very important, exactly, to help people, the necessity. And then, because really, I tell you, my mind is, I have a lot of ideas, I don't do all of them. Really, it's coming, I don't know. I told you, it's a blessed, I cannot explain it, it's easy. It's like a singer can sing, I don't know, for me is what Leonardo da Vinci dream is coming easy for me and I understand it. So the combination of understanding biological, because you cannot, I see many copy of implant, even copy of my implant, and I laugh when I see it, because I can see it, when I see the implant, I can see how it's written on the bone, because me, when I have my innovation, I make the hole, I'm going myself inside the socket, and I look there in the bone, and I say what it have to be, how it will stay nicely. Okay, so I'm on the bone, sitting there, looking, cortical, bone, vessel, biological function, and then I say, okay, what I need to get good anchorage, to get biological one, not to make necrosis, how I get a beautiful biological width, and so this is what I feel, okay? And then you take all of this together, and then you come with the idea. Now, for me, it's very easy, because I'm like a small engineer, so I know how to make the drawing, I understand biologically, and I can do the implant myself. I can do the implant with the machine today, and the next week I can place it or check, but before I can place it in different type of wood and bone, and I can get quickly the understanding. So I can really shorten the time. And this helped me.
Yeah. I mean, looking at your progression of the implants you developed over the years, and I think a lot of people are aware which implants you've been innovating, starting with Alpha Bio. The last one you brought was the
Alpha Bio, with all the line, Nobel Active, with all the line of Nobel Active, and the best one,
Straumann BLX.
Straumann BLX, DLX.
So, and now you told us a story that you went to the university in Israel, and the guy was looking at it, said, look, I'm not using it, too aggressive. But today, I think, these type of implants, these fully tapered implants, as we call them today, yes, have changed, I would say, implant dentistry. How do you look at this?
I'm very happy to see this, because, you have a dream, and you think that you can influence, but you are not sure that you can do it. You fight for it, you go for it. And then, one professor in Israel told me, he said, Ophir, maybe you don't understand your influence, he say. Because all the world was copied the Brenner-Mark implant, the external legs with the small thread of metal. And then you come with the SPI or Nobel Active or BLX. And then after when you come with the Nobel Active, all the world was changing, and all the world copy the Nobel Active. So it means you make a big influence of the work for a passive implant to a more active implant that can really make the function, and is better biologically. Is very better. So it was like a learning. So beginning was doing clone, then I get because I don't like to do something if I'm not fully confident in what I do. I don't play. I check it very good. So I'm a chicken. I'm afraid to do something that it will not be really proof. And this is what I love in Straumann. All the time checking, and more checking. And I love it, because you cannot make mistake. With this procedure of those team, you cannot make mistake. So I was, really want to do it, and I was afraid and go step by step and try really to improve it. And for me to see, for one side you see people copy you. For me is I'm flattered. Okay, I don't care. I know company will kill me, but I'm flattered. Even when they copy the company, is mean that the company was giving a lot of influence, and in the end it's helping to the people. But it was more nice if the people get license than to make the correct implant and not make a bad copy. Because a bad copy will not work all the time the way it's have to work. And I see a lot of mistake by those people that making the copy. Sometimes I want to help them, but I'm afraid.
Maybe let's look a little bit also into the collaboration that actually we had with you, Ophir. So I think it's fair to say when you came on board, it was kind of a cultural shock.
Yes.
Because we came from this very, I would say, gentle threads of the tissue level implant lines. And also these type of threads that were initially used for more mechanical metal connectors, and then you came with these ideas of the deep threads of the fully tapered implants. But I must say, also working together with you, it was very impressive. Your hand-mind interaction is incredible, because you're one of the very few persons that I had the chance to get to know that can, from a tactile feedback, recalculate how we need to change design.
Exactly.
And this was really something outstanding.
Yes.
But I mean, I have to ask you, Ophir, how was it for you? I mean, how was and you mentioned it before with checking. How was it to actually collaborate with the Straumann team?
I tell you, Straumann team is a dream. It's a dream team. The best engineer, the best group, everything is perfect. Really. I love to work with them. But it's a struggle. You need to fight. I remember that I was making the new implant now that coming, the 4mm, that we work very hard on him, and I think that is a wonderful implant.
The TLX.
Really. Yeah, the TLX is between bone level and tissue level. Mm-hmm. It's something new that I think we have to show the people why it's new, because there's a lot of biologic behind it. And the team was doing their prototype and I was doing prototype. And then we bring some doctor to evaluate it. So all the digital showing very similar. Like the cover visualization, like the stability was...
The data measured,
Data measurement was very
similar,
precise.
Yeah.
And of course, they don't let me talk with the doctor and the professor that doing the hands-ons. They put me beside not to influence them.
That's not true. You were there.
I was there, but I cannot talk to them. No, I say it for good.
Yeah.
No, it's good. It have to be this way. It have to be transparent and honest. If no, I don't want to put my name as the best one, because there are many better people than me, for sure. Because if you think that you are good, you are very stupid. If you think that you are good, it means your brain is not really function. If you think that you are good and you are it's not. So I really respect all the other idea. And then when everybody do tests, they say, your design is better. And the engineer, I remember, say, but why? It's the same number. And the professor, the doctor say, it's the feeling. It's the feeling. And really, when you take a carpenter and you give him different screw and the screw will look the same, you tell you, this is better than this. So this is what I tell all the time the engineer. If I'm the pilot and I'm flying the aircraft and I do reverse and I feel that it's vibrating and I tell you, look, it's vibrating and this speed, I need this and this. So please do
help
this. Because you cannot be, I don't have knowledge of engineer, but I am practitioner. Okay, I can understand the engineer. I can talk to them in the same language, or I can give idea, but I'm not an engineer. But when I take the implant and I put it to the bone, I will tell you immediately exactly what to say, and you remember this. Make it a little bit longer, make it a little bit deep, go upstart a little bit, go there a little bit, and then it will be perfect. Because I see it, I told you from the beginning, I can see it. It's very easy for me to see. Because when I look at the implant, I see, okay, here it will press, here will not be, this will cut, this will not be. Where's the drill? I see it.
I can fully support this. So this
was there.
Yeah, I was there.
You was
and
there
it's
all
like
the time.
it's incredible. So also you took different materials and you just tried out, and actually you got a feeling for little changes that probably are not measurable in standardized
I can
methods.
Feel it.
You can feel certain stuff.
I place in my life more than 150,000 implant. 150,000 implant. You have the feeling already. Like the doctor, when he do root treatment canal, when you have experience, he can tell you where's the apex. Why? You see the length, you see the places, you see the diameter, he can know roughly. So for me, is because I do so many and I'm orientated, so it's very easy.
We have to try to put your brain into AI. So
I love AI. I use AI all the time.
Now, maybe on the flip side, this is now very empirical and it's from one person. On the other side, how do you see the importance of actually science-backed clinical advancements? Is it still important in implantology today, or have we already passed a certain point where we know what's working, and now there's only increments that it's not so important to do clinical studies? How do you see this?
No, inverse. You have to do clinical study, and you need to do clinical study, and you do animal study, because people are not your experience. So you have to check everything very rigorous and very deep inside. Now, biological, we have, for my more than 30 years in implantology, I see all the fashion that was. I see the first fashion of a media that was with aperiosal implant. I see the blade. I see the cylindrical implant. I see the needle implant. I see all of them. I was there. So I was all of them. And, you get more knowledge and more knowledge. But the knowledge have to be in biological aspect. Now with BLX, we took different approach. We took a holistic approach. The holistic approach was, where is the stress coming? Where the stress is going on the crown and bridge? How the stress going to the connection? What type of torque connection that will take the stress away and put it inside the implant? How we stop the micro moving? How we make long epithelial junction by doing the biological weight with a special type of abutment that have more long and tulip shape. How we look at the cortical, where is the stress after the stress is going down? How we have more cortical, so we have a narrow one. How we have gingiva that grow. How we treat the spongios or different spongios, because the bone have different area around it. So how I do cut, collect, condense, and disperse, and my implant will not be an implant, it will be an instrument. So it's a holistic approach. And this is based on research, on biological, on scientific. All of it is come together. So from the part of engineering, for fine and fundamental anesthesists, for bioelastic, for all of this, we have to put it together. And this is what is great in Straumann. It's a dream. I tell you, if you ask me to do it free, I do it free, because you have all the resource. You have all the resource, and this is a dream for me, to work here is a dream. Fine fundamental analysis, no problem. German university will do. We need this machine, it's downstairs here. We need a prototype, is there. Everything is here. And the team and the engineer and the group, and it's like family. So what you need more than this?
Thanks for the flowers, Ophir. And I think, to be honest, we have a great team, and there's a lot of people that are long in the industry, and experience plays a big role, as you also said, with 150,000 implants placed. And the same is probably for people working in the industry. I would like to zoom out a bit from inventing implants. You owned your own company. You have collaborated with some of the largest manufacturers in dental. But you're also consulting startups.
Yes,
I do. You are a creative mind.
Free.
You did a children's book, actually.
Yes.
From all these accomplishments that you see, what is the one that you are most proud of?
The mission.
The mission behind, or
the mission. First, if I look not at the family, I look at the business point. First, the mission that I success to put those implants that go for immediate loading for the benefit of the people. This is my
legacy.
Yeah. This I feel good because, you need, when you come to this world, you need to come in peace, in honesty, and contribute because we are one family. I have a dream. I go up to the sky and I see one word. And I go very close to the word. And then I see blue, water, trees. And then I see some animal in Africa. I see the lion, He's sleeping all day, like we have lion, yeah? And when he's hungry, he eats something and finish, and all the animal. And then I see some stupid animal doing weapon, killing each other, have proud. This is stupid. This is stupid. What animal this is human being? We need to change it. We have to give mission. Treat him like a father, mother, and sister. Do something for the benefit of the people. We are a small world, because if somebody will come from where to attack us, we will unite in 1 minute. All. Christian, Muslim, Jewish will be one in 1 minute. So the same in implantology. We have to be united.
From all that you've learned and experienced over the recent years and decades, if there's a young generation of inventors, which we hope there is a young generation of inventors in the implant dentistry, and we see a lot of smart, visionary people out there.
For sure.
What is it, looking back, what is your advice to these young inventors?
So first, if you believe in yourself, have the power to try this one. But you have to have big listening, and to listen to take your proud to zero. Because if you have proud, this will kill you. So take proud to zero, listen to people, open your eyes, try. But if I go to be more practically, if you have the power to make a small prototype for yourself and to try it before you're going to raise money and to destroy people, and I see many of them that I try to help them. So one come with an implant that look like a disc implant, and Ophir, look, and I take him and say, look, I first of all, I don't want to stop you. But I tell you honestly, I don't think that you have indication for this, and you going now, you're already 2 years, and you take money for you, money for them, you continue. Try to move to something else. This is my advice to you, and unfortunately, the work 6-7 years and nothing come out of it, and not one, many. So listen, don't live on a dream. If you see that the reaction that you get around is no, so stop and move to another one. Don't insist, because you can spend your life of a dream, and some doctor have a patent, they put the patent on the frame and he have a patent. So what is the patent? Why you need a patent? To show, to be proud. Take proudness to zero. When I wake up in the morning, I see where is the shadow, I push my shadow and I go to work. I'm simple. I told you, I'm a very simple person. Simple. I feel simple. I don't feel that I'm an inventor and I don't feel nothing. No, I'm simple one. I just want to help.
Reflecting a bit on your journey, I think this doer attitude is something that made you, I would say, very, very successful, because you just want to do things. And we also had this in our development collaboration. I mean, sometimes you just came back with an instrument that basically you gave to another company just to make some samples, actually to get faster ahead, to figure out whether it's something really worth having. So I believe this is maybe one of your superpowers, that you can not only see things based on the tactile feedback, but you're very practical. And obviously that seems also to be an advice that you would like to give to young potential entrepreneurs.
Exactly.
Yeah.
Exactly.
Now, looking a bit...
In my clinic, I make a lot of tool to myself. I make sinus leaf, I bend, I put fire, I make my instrument. Because it's more easy for me,
I saw this in your practice. So.
Yeah.
Now, looking a bit into the future, Ophir, what do you think could be, the next big step in terms of innovation when it comes to dental implantology? Is there anything that struck you, that you saw, or that you have in your mind that you believe, okay, this is something that will change maybe the next decade?
Yes, I tell you, I have an idea. I will not tell you until I put a patent.
Put proud aside.
but yes, I think that is no limit to move ahead. And if somebody thinks that is a limit to move ahead, he have limit to himself. So I see a lot. I see, first of all the AI. So for me, first we have to look at this like this: patient, doctor, and result. So patient, first of all, the communication with the patient. We have missed a lot of it. I told you before about Dental Master that we put some algorithm and that will show a lot of plant treatment. Now we're working on AI with the X-ray, okay? So if I have this algorithm that can make me plant treatment, so it means even my mind don't think I can make more than 1 million option, because I tell the software, this missing, this missing, this missing, and the software will give me more than 1 million, will generate 8 that I can change them. Then we go to the city. I look AI at the city. I see if the defect is really good or no good, and then I need to change. And I will put the patient to sign on the video, a personal video for him, because today is many lawsuit. I did not understand what you do. I did not this. So this first one, communication with the patient, show him everything, be safe. Then we go to the patient. Digital flow for the young generation is amazing. Amazing. Okay, is amazing. Because I will do for myself the digital flow, because it will be difficult for me to do to myself. So digital flow is amazing, and we see how Straumann making the tray and the navigation, and I think it's very, very good, because today the new generation of dentists, my son is now in the first year, my daughter, she's a dentist, my son, so I see their orientation, I talk to them. So, because for experienced doctor, it's normal, it's simple. What is Relentless? So what is zygoma? What is sinus? It's nothing. Yeah, but we have, when I do implant or I do protocol, I think about the small one, not about me. What is the small one? So this is really have to develop a lot. And for the implant system, yes, we can improve it. We can make more nice tool, more nice instrument. We have a lot to really make it very nice, so any dentist can go to a high result. Because what we want is not to make experience on people, to let the dentist to have confidence. We support him all the envelope, okay? And we support him all the envelope, and he can succeed. And this, I see this, what you're doing, and this is the way. But digital flow will have a lot of effect. Today we have even robot that will doing the implant in general medicine, but in dentistry as well, they start to have robot. So it's really you have to look at this in all this, like patient education, patient communication, CT scan, like the AI will give you some opportunity that maybe you don't think about in the X-ray and the CT scan. And not only on the bone, macro. You have to look at the face, if I need to take it out, if I need to take it down, like orthodontic. So to look more macro, not to look here, to see the picture from above. Education, patient, treatment, this, and instrument, and of course the implant. And I don't speak about, we are privileged. We have rock solid. We have titanium with zirconia, so it's the best material and strong, that this allow me to do the BLX in the way it is, and it will be difficult to do it without. SLA active, so we have the best material, we have the best technology, Swiss precision. So this is a dream, this is a dream. For me, it's a dream, to have this and to come with a product. I'm very proud in this product, really, I'm proud. I'm proud of the quality, and not only the design, the quality. Quality is important. When I don't know what is a screw opening. I don't see it. I don't see breaking. I don't see those. And then I explain people, the quality and all together is very important.
I think that's the result of the checking.
Yes,
that you mentioned
checking.
Before.
I tell you, we do in the BLX. We do one animal study. The animal study was good, and then they say we do another animal study, and I say it's $500,000. Why you do another animal study? We want to be sure that the first one is good, and then they do the third one. Why the third one? To be sure that the two are good. Now I understand. Okay.
Ophir, I think we really share your passion and your view that that there's still a lot that we can develop in this treatment area.
Yes.
that there is no end to innovation. I think we share this passion.
It's no.
Ophir, I would like to bring this back again to the young generation a bit. Today, I think it's also about bringing implant dentistry to every dental professional out there, because today it's not the standard that everybody's using.
Yes.
You spoke about your kids that are embarking on an implant journey now. What do we have to do to make sure that more and more clinicians are starting using implant dentistry and helping with this more and more patients to receive this treatment?
I tell you what I think. Theoretical course is nice and good. It have to be more personal involving. The education have to start first from university. We need to help university to educate their people, their dentists, because they don't have enough knowledge when they're coming out of university. So we have to go there. We have to put in the internet a lot of free lecture. So if somebody don't have money, or he stay in Africa, or he stay whatever, he can have the opportunity to learn free. So this will help him to get it. We have to give information to the patient. This is very important. This is our role, because patients don't know what they can achieve. So it's nice story of people that have prosthesis and after this don't have, and they have this and they don't have this. We have to go there. And then for me, I love to do a life surgery course. Because in life surgery, of course, you do the normal course and everything, but after the next steps, it's have to be life surgery course. You have to get the courage, the doctor, you have to see a video of this with explanation. So we need to give really this one. And one of my success before it was that I was keeping tech doctor and say, you want to put implant? Come, I watch you, I catch your hand. Place 1-1. Mm. But you have to promise me, you do this to other.
Mm. To multiply.
Yeah.
Of course. It's not that I teach you and you don't teach the other. And ask the older doctor, please give your small secret. Don't keep it. I can see in a lecture when you try to don't say that, okay, here I have to put the implant more deep, then I get more aesthetic because I make the biological width, and I cut palatinal to have this. You have to say it, because this is essential. Not to show how great you are, a beautiful picture. Who care about this? When I come to the lecture and I go down and some doctor comes, wow, great, Ophir, good. Say, you are not my friends. Say, why? He said, because you just applaud me. I need 5 critical comments so I can improve myself. Give me 5 critical, then you are my friends. And I say, oh, you was with your back to the camera. I said, thank you. This picture was not clean enough. I said, thank you. If no, how you can improve yourself? Because you work like this one,
It's the difference between a presenter and a lecturer.
This,
actually, as we had.
The children book that I do was talking about honesty, friendship, fighting. It's speaking about a toucan that stay in the safari, that he liked to run away from the safari. It's a long story, not now. Maybe we put it in Straumann and you translate it and give it. It could be a nice idea.
It's a good idea. So as always with you, Ophir, I think it's very enlightening discussion. Now, we have it as a rule that also our guests can ask us a question,
wow.
Ophir. So,
you sure?
Yes, sure. Go ahead.
Okay. I will ask like this, Straumann is a was very conservative company. Rolls-Royce, everything best, ITI, protocol. So when I come to Straumann, I was like, coming to a company that are very, very conservative. And I come with a crazy idea. Lion Claw, BLX, cut, condense, despair, immediate loading. I know that it was not easy to accept me, like with those crazy ideas, but I really love to know now your honest question. What this done to Straumann company for both of you?
I think I can start. I leave the development part to George because you've been really in the middle of it, George. And
George was all the time.
The only thing I can tell you guys, obviously, you had a lot of fights and discussions in this development, but it turned out to be one of the best products you both ever have developed. And then I think that's
of course,
that's an important takeaway.
We cannot.
It takes these discussion and these discourses to make it really a great outcome.
Of course.
But moreover, I think. George, you take the technology part. I think, Ophir, this development was really also part of our cultural journey to be more open-minded and, to get rid of some paradigms that we strongly believed in and that were also self-limiting to us. And I think we shared this journey also with the ITI. It just opened us, and we looked at the world a bit differently. And I think what we realized as a company, I started in this company when we only had the tissue level implants. So we moved away the tissue level paradigm, came to bone level and realized, that was good for the company. Then we came with BLT, was actually good for clinicians, patients and the company. And the same happened also in a bigger magnitude, I would say, with BLX. So I think it was a very important impulse in also our cultural journey to be more open-minded. That would be my 50 cents.
I mean, there are so many layers to this question.
And what is done to the company? He put the company on different age.
I mean, there's no doubt. I mean, and I think everybody knows. I mean, the growth of the company that we have seen over the last 10 years has been mainly due to key innovation we brought to the market, and BLX was clearly one of those innovations that helped us grow. I mean, we gained a lot of new fans. A lot of people started to use Straumann implants that never dared to use Straumann implants before because they always looked at us and said, look, wow, we love the scientific part of this company. We love Roxolid and we love S-Elective and we love the service and whatever. But they're not having the right implant material for me. But when we introduced the BLX, a lot of the people said, wow, okay, finally they also have the implant material that I need for my type of treatments, which oftentimes was immediate type of protocols. And thanks for the question.
Yeah, maybe to add to this. So first of all, I like constructive tension because I honestly believe that it makes things better. And if there is, I don't like if people tell me, well, this is how we always did it and this is why we're not going to change it. So the world changes, and I think we have to constantly ask ourselves, well, is it still good enough? Is it good what we're offering? And I think, the project that we had together off here, it really shook the tree. So, and sometimes I think companies they need this shaking, and in the end, some fall down and some things stay up, and you have to be conscious about, now what are we doing with this? And I think particularly what did it do to the company is it created a open mindset to look at things that in the beginning look radical, but then you need to deep dive into it, and there is a good thing to it. And I think you came in at a point in time where this topic of immediacy was super important, but still early. And I don't believe that you have to be in all the things the first mover, but I believe that you have to bring a product that really caters to a patient need, to a market need, to a customer need. And I think you were very convincing and also helping us to understand it's a new age. So there is this age of it's possible to do immediacy, maybe not in all the cases, and you need to selectively find the right patients. But this actually led to I would say, very important development for us. And what I would like to also, from a technical point of view, carve out is the connection that you develop together. I think now has become a core of further developments. And I believe that this is the best connection that we have done so far. And I think it's a foundation where we can build on. And this is something that really, this changed the company, I would say. Andreas, what stood out for you in this conversation with Ophir, a very open one? So what are your highlights?
Yeah, this is tough to summarize, Ophir, I have to say. There were a lot of good dimensions. I think, first of all, we saw a very visionary mind, Ophir. I think you see things three-dimensional and you feel them that other people don't see. So you're very visionary. But what I like is you're visionary connected to a purpose. You do things, you set a mission, you do things because you want to do good things for patients and improve treatment and ultimately, improve in the medical field. And I think this combination of being very visionary, driven by a purpose, is very powerful. It's a very profound thing, but very important. I mean, your patient centricity. I mean, what you said in the beginning, treat every patient like he or she would be a part of your family.
Father, or sister.
Exactly. And I think that's so important, to keep this in mind. What implant would I use? What treatment would I do?
Exactly.
If it would be my mother, my mother-in-law, whatever, my brother.
Yes.
I think this is it's probably a very good compass to have from an ethical perspective. And then I think the most important one is, I think we saw a super curious person. I think you are extremely curious. I mean, you traveled the world to learn about dental implants and progress. You're a good listener. You ask questions and you listen. But you're not only curious, but you have this bias to action. You are really a doer. And I think this is really... That's what I also think what you encourage the young generation to do, believe in yourself and go do.
Yes.
And I think based, of course, on experience.
And the mother.
Exactly. So thanks a lot for sharing all those insights.
Thank you.
Excellent, Andreas. I mean, the only thing to add is I perceive you as a very passionate person. Yes. I think you really burn for the thing. So this is also what's translating into action. So Ophir, it was a real pleasure having you. Thanks a lot for the open conversation and for taking the time with us.
Thank you. It was a pleasure.
So now for our listeners, I hope you enjoyed this episode. I hope you took away some magic moments that actually maybe sparked also your interest. Maybe some of you are looking into maybe founding your own company.
Come to the course.
Or come to the course, exactly. So please like, subscribe, and also watch out for the episodes that are already available on the usual channels. So be it Instagram, YouTube, or also Apple Podcasts. And please look out also for the next episodes that are coming your way. Thanks a lot for listening in and enjoy the rest.